If you're over 55 and you constantly feel like there's something stuck in the back of your throat, a thick, sticky mucus that you just can't clear, no matter how many times you cough, swallow, or clear your throat, you need to hear this. Because that annoying little throat thing you've been ignoring for months, maybe even years, could actually be your body waving a red flag. And here's the part that surprises most people. It's almost never just allergies or just getting older. There are four very specific reasons this happens after 55, and reason number three is the one almost nobody talks about, yet it's becoming more and more common. Stick with me, because by the end of this video, you'll understand exactly what's going on inside your throat, and more importantly, what you can actually do about it. Let's start with why this matters so much after 55. Your body changes as you age. The muscles in your throat, the glands that produce mucus, even the nerves that control swallowing all shift over time. What used to be a quick in your 30s can turn into a constant nagging sensation in your 50s and beyond. And while it might feel like a small annoyance, that mucus buildup can actually be your body's way of responding to something deeper happening internally. So let's break down the four reasons. And trust me, some of these might completely change the way you look at that throat tickle. Reason number one, postnasal drip from chronic sinus changes. Think of your sinuses like a gutter system on a house. When you're younger, that gutter system drains smoothly. Rain comes, it flows down, and everything's fine. But as we age, the lining inside our nasal passages and sinuses gets thinner and drier. The mucus that's normally produced to keep things moist and protected can become thicker and stickier, almost like the gutter is now clogged with leaves. Instead of draining forward, out of the nose, it drips backward down the throat. This is called postnasal drip, and it's one of the most common reasons people over 55 feel that constant throat clearing sensation, especially first thing in the morning. A catchy way to think about it: imagine your sinuses are like a leaky faucet that's been dripping so slowly for so long you've stopped noticing the sound, but the bucket underneath is slowly filling up. That's exactly what's happening in the back of your throat every single day. Reason number two, acid reflux that doesn't feel like reflux. Here's something that surprises almost everyone. You might think acid reflux means heartburn, that burning feeling in your chest after a big meal. But after 55, reflux often shows up in a completely different disguise. It's called silent reflux, or LPR, laryngopharyngeal reflux. And instead of burning your chest, stomach acid creeps up quietly into your throat and voice box while you sleep, without you ever feeling that classic burning sensation. Picture this. You go to bed feeling totally fine, no heartburn, nothing. But while you're asleep, lying flat, gravity isn't helping you anymore. A small amount of acid sneaks up your esophagus and irritates the delicate tissue in your throat. Your body responds the only way it knows how, by producing extra mucus to protect and coat that irritated area. So you wake up with a throat full of mucus, and you have no idea why, because you never felt the fire that usually comes with reflux. This is incredibly common after 55, especially if you eat dinner late, lie down soon after meals, or have gained a bit of weight around the middle over the years. Reason number three, changes in swallowing muscles, something most people never even consider. This is the one that catches almost everyone off guard. As we age, the muscles involved in swallowing, yes, the same ones you use every single time you eat or drink, can gradually weaken. This is sometimes called presbyophagia, which is just a fancy medical term for age-related changes in swallowing function. Here's a simple way to picture it. Think about how a young garden hose is flexible and snaps back into shape easily, but an old hose becomes stiffer, slower to respond, sometimes a little kinked. Your throat muscles work in a similar way. When swallowing becomes slightly less efficient, Small amounts of mucus, saliva, or even tiny bits of food can linger in the throat longer than they should. Instead of clearing away naturally with each swallow like they used to, they sit there, building up that thick, mucusy sensation that never seems to fully go away, no matter how many times you clear your throat. This is one of the most overlooked reasons, because it doesn't come with any dramatic symptoms. No pain, no burning, no sneezing, just that persistent nagging feeling that something is sitting back there. And because it develops so gradually, most people don't even connect it to their swallowing at all. Reason number 4, certain medications you might already be taking. This last one might genuinely shock you. After 55, it's common to be on at least 1 or 2 daily medications for blood pressure, cholesterol, allergies, or even mild anxiety. But here's the thing. Many of these medications have a side effect that almost nobody warns you about. They can dry out your mouth and throat, or paradoxically, increase mucus thickness as your body tries to compensate for that dryness. Blood pressure medications, certain antihistamines, and even some antidepressants fall into this category. Imagine your throat is like a plant that needs the right amount of water. Not too much, not too little. When certain medications throw off that balance, your body sometimes overcorrects by producing thicker mucus to protect tissues that have become too dry. So that bottle of pills sitting on your kitchen counter that's helping your heart or your blood pressure might also be quietly contributing to that throat sensation you've been dealing with. So there you have it. 4 reasons. And notice something interesting. Not one of these is just because you're getting older. Postnasal drip from changing sinus tissue, silent acid reflux you can't even feel, weakening swallowing muscles you never thought about, and medications working behind the scenes. Each one is real, each one is common, and most importantly, each one is something you can actually address once you know what's going on. Now, here's what I want you to take away from this video. If you've been living with that throat clearing habit for months or years, telling yourself it's nothing, I want you to start paying attention. Notice when it happens. Is it worse in the morning, after meals, when you lie down? These small clues can help you and your doctor figure out which of these 4 reasons might be affecting you the most. Simple changes, like staying hydrated throughout the day, avoiding eating too close to bedtime, elevating your head slightly while sleeping, and reviewing your medications with your doctor or pharmacist can make a real difference for many people. But here's the most important thing I can tell you. If this throat mucus sensation is new, getting worse, or comes along with other symptoms like difficulty swallowing, unexplained weight loss, hoarseness that doesn't go away, or a lump sensation that persists, please don't just brush it off or assume it's one of these 4 reasons. Make an appointment with your doctor. They can examine your throat properly, ask about your full medical history, and rule out anything that needs more attention. This video is meant to help you understand what's commonly going on and start a conversation, not replace a real evaluation from a healthcare professional who knows you and your health history. If this video helped you understand something about your own body that you've been wondering about for a while, do me a favor, give it a thumbs up, because it genuinely helps this information reach more people who are quietly dealing with the exact same thing and don't even know where to start looking for answers. And if you want more videos like this, where we break down those everyday symptoms after 55 that nobody really explains properly, make sure you subscribe and turn on notifications, because we've got a lot more of these coming. And trust me, some of the upcoming topics are going to surprise you just as much as this one did. Take care of yourself, listen to what your body is trying to tell you, and I'll see you in the next one.